Well, the agency did take a lot of steps. Quite literally, if you look at the number of things that we did, we took hundreds of steps to try to regulate e-cigarette products and control use by minors in particular. If you sort of step back and look at the history, when I came into the agency, these were newly regulated products. So I implemented what we call the DME regulation, the regulation that regulated e-cigarettes for the first time. So that hadn't been implemented. The Tobacco Control Act had been passed 8 years prior to when I arrived at the agency, and it took 8 years to get that rule out. I implemented that rule. So we were implementing regulation on e-cigarettes for the first time, and we didn't have in place any of the guidance documents or regulations that would say, this is how you file an application. So when I came into the agency, we announced a comprehensive plan in the summer of 2017 that we sought to regulate nicotine in combustible products to render them minimally and non-addictive, hopefully to migrate adult smokers off of combustible tobacco because they'd no longer be able to get access to nicotine that sustains the addiction. At the same time that we saw an opportunity from things like electronic nicotine delivery systems, and in particular e-cigarettes, to offer an alternative for adults who still wanted access to satisfying levels of nicotine but wouldn't be able to get it through combustible tobacco. Ideally, we'd like to migrate adult smokers off of nicotine altogether, or if they still want to use nicotine, onto medicinal products, which are much safer. But if they still want to inhale nicotine, we saw the e-cigarettes as a viable alternative for currently addicted adult smokers. That was the framework. And we gave the e-cigarette manufacturers more time to get the applications in part because we were regulating them for the first time, and in part because we didn't want to sweep them off the market at the very time that we were seeking to regulate nicotine in the combustible products. That was the framework we went forward with. What we didn't expect and didn't anticipate was the dramatic rise in youth use of the e-cigarettes that would ensue between 2017 and 2018. So when we got the data in August of 2018 from the National Youth Tobacco Survey showing the very sharp rise in teen nicotine use, a 78% increase in e-cigarette use among high schoolers, we took quick action. We called it an epidemic for the first time. About 2 weeks or a week after I got that data, I went out and called it an epidemic for the first time. We announced that we would be taking action to restrict access to the flavored products in particular because we needed to reduce the access and appeal of these products to kids. We announced that comprehensive policy in the fall and then put out that policy in a draft guidance document in March of the following year. So in less than 6 months, we completely changed our policy to put in place new restrictions on sale of the flavored products in particular, recognizing that the flavors were a big driver of the youth appeal of these products. So with 2020 hindsight, had we known 2018 was going to happen, had we known what was underway and that we'd see this sharp uptick in youth e-cigarette use, yeah, we would have made different decisions. But I don't think anyone foresaw that. None of the public health groups were telling us that there was going to be a sharp rise in use. We really didn't start to have the first indications that something was happening until early 2018 when we started to get anecdotal reports from particularly school teachers. We started to hear things from the high schools, and so we knew something was underway, but it wasn't until we had that data in the summer of 2018 that we had a clear picture of what was happening.